Hey, I'm Dr. Seiler, and we're going to film a short video today with me doing a little bit of Juvederm, a dermal filler, to help one of my very good patients get a little bit of a nose job. Miss Jenny has been seeing me for a couple of years. She's had this done a couple of times and has been real happy with it. Some people that have a little bit of a hump in their nose that don't really need a nose job, I can put a little bit of filler in the tissue to help kind of soften that nose bridge. And people are a little concerned that it will make their nose bigger, but it really doesn't. It just really softens the skin out. And she tolerates this procedure really well. It's not very painful, and you'll see here how well she tolerates it and how quick it is. And if we can get a close-up, she's been so nice to volunteer to let us do this today. You can see that she has just a slight little bony hump right here that she can see in pictures and makes her a little uncomfortable with it. So what we do is we put a little bit of filler here, and we put a little filler here just to kind of soften that, and it gives her a nice straight line right there. So I'm going to actually do this from the other side of the patient here. Let's put her down just a little bit. This actually doesn't even require any numbing because it's just a really quick little shot. And we use a filler that actually has a little bit of numbing medicine in it called lidocaine. So just kind of pull the skin up here. And you can see where even she has a little bit of adherence of the skin there to that slight little bony hump. So we do a little pinch here. And just inject real slow. It's not hurting you too bad, is it? You can see how easy that is to do that. It's already helped a little bit there without having to put much in. You've had this done twice, haven't you? Mm-hmm. First time we did it was back in 2009, and we don't put very much in. So in her, it lasts about 8 months. In her, the average is 6 to 12. She gets to come back and see me whenever she visits her daughter. She lives in another state, so and you can see how nice of a difference that makes right there. Just a little bit of bleeding right there that's easy to control.
Dr. Seiler, how long does any swelling last?
Not too bad at all on the nose. It's pretty rare to bruise. It's just a couple of individual little sticks here. Once we do the first stick, usually they're numb from the numbing cream in it. And did you feel that much?
A little.
Not bad though. I just do this real slow. The other thing is too is that they'll get a little bit more volume with time, so about a month after is when they really see the result. So that gives her a nice little softening there, and you can see now that the beginning of the slope of her nose starts up here instead of down here. It's probably a little difficult to see on the video, but she's been real happy with it. So now we do just a little bit right here. This is just a little bit of a sting. And this is an area where we don't have to put much in at all because there's not much room right there. Hold a little pressure here to keep it from bleeding, and we're just about done. We've only used we had about a quarter of a syringe left, so we've used about half that. So we really only use about a quarter syringe of Juvederm. So all right, we're going to do one more little stick here and we'll be finished. Alright, I'm going to hand the syringe off here, and we're going to hold a little pressure, and that's it. We're also going to do something else in her. We're going to make this a separate video, though, so that the video is not too long. So if you want to click on one of the next videos, we're also going to do kind of a mini liquid facelift. We're going to do some in her upper and lower lip and a little bit in her, what we call the nasolabial fold, the cheek area. And we're going to do a little bit in her jawline here to kind of help lift that up just a little bit. We'll probably put just a little bit in the peak of her cheeks, too. So this is a great procedure to do for somebody that doesn't really need or want surgery and wants to do something that's a real minimal downtime type of procedure. And Botox and Juvederm can really give a nice result in the entire face to recreate the proportions of the face and add volume as you start to lose volume with age. And it's minimal downtime. Jenny actually got a little bit of a bruise the first time we did her upper lip, which is, isn't real common, but it is possible. So we always tell people to know that they can have a little bit of bruising with it, but most of the time it's not too bad. So.